So first thing, what is the definition of sterile?
Non-contaminated. It's like, it's not contaminated in any way.
Yeah, it's all microorganisms are absent.
Okay.
Okay. So what are some situations that we would perform sterile technique as nurses?
When we're doing anything sterile, so like anything that is invasive.
Yeah, so like
Needles.
needles, okay, well surgical asepsis, like completely sterile. So like,
Oh, okay.
we'll talk about that more, but so things like OR, in the OR we have to be sterile.
Mm-hmm.
When you're inserting a Foley catheter, you have to be sterile, right?
Mm-hmm.
So there's a difference between alcohol pad and actually betadine, that's sterile. Alcohol pad is
Okay.
medical asepsis, which is just clean, and we'll go over that later.
Okay.
Also, any like dressing changes on any wounds, those have to be sterile.
Oh, okay. You know that.
And like central line changes, do you know what that is?
Yeah, the central line that goes to the
Mhm.
heart. Yeah.
Yeah, those have to be sterile because you have to change it every 3 days or every week, depending if they have a bio patch or not. But you'll learn about that in lab.
Okay.
So those are just some examples. Remember, so suppository is not sterile,
Yeah.
and neither is NG tube because the GI tract is considered outside the body, so it's
Yeah.
not sterile.
Okay.
Perfect. Okay, so you guys talked about when you obtain a sterile field, right?
When you set one up, kind
Yeah.
of thing. Yeah.
So what are the rules once you have a sterile field?
Um,
They're gonna ask you some of the tests, like step outlet apply, or like scenarios, things like that.
like you don't cross over it.
Yep. Don't cross over field. That could just transport some microorganisms.
Mm-hmm.
Yeah, so don't reach across. What else?
Like if there's any, like if it gets any moisture, if you spill anything on it, then it's considered
Mhm.
non-sterile.
So, if it gets wet, do you know why that is?
Because like he said that it soaks up the bacteria from underneath the cloth, right?
Yeah,
that's how he
because-
explained it.
Because if the water falls on your sterile field, that like water or paper or whatever is in between that
Yeah.
is now permeable. So now the
Okay.
microbes can use the water and get through.
Okay.
So yeah. Random piece of paper. Okay, what are some other ones?
Probably. Let's see.
Hands above waist.
Oh yeah, and then you have to like don't touch any of your clothes or anything like that.
Yeah.
So
Don't
like
touch anything.
anything-
Keep your hands above your waist.
And then if
So
you
if you drop it, your hands are sterile. You have to re-glove.
yeah. And then another one is like if you take your eyes off of it, so like if you leave
Yeah.
the sterile field.
So always face sterile field. Right, so like in the ER, or sorry, OR, it's a student and you're in there, and the student's like the sterile field, they won't even let you walk across like this, because you're not like walking across like this. So, let me put this on. There we go. So yeah, make sure your sterile field are always facing it, so never turn your back to it. If you're uncertain about something like is it sterile or not, it's just considered not sterile.
Okay.
So uncertainty equals not sterile. Okay. How big is the border, the sterile border?
1 inch
Yeah,
on the
so-
outside.
Yep. You can't talk or sneeze or cough across the field. And this more applies for like the dressing changes and everything.
Mhm.
In the OR, you're gonna wear a mask, and then it's fine to talk.
Okay.
It's like the surgeon, right? He's right over
Mhm.
there with the mask, so that's okay.
So like if you did have to sneeze or something and you like turned your head or you kind of got away and you sneezed and then you came back, is that okay?
Just make sure you like fully cover it.
Uh huh. Okay.
Yeah.